Upward Health focuses on physical, behavioral, and social. So once I get the pieces of the puzzle, I'm ready to call the patients and address any health concerns they may have, any gaps that I may be missing. Now, if it's a field visit, I do the same. I check the electronic health records, go over anything that I've missed. If they have to do a facilitated visit, then we will schedule one. And that's just a small task that I'm talking about. I do plenty more, from scheduling appointments, transportation services.
First, what I do, I go over all of my notes and make sure anything isn't sticking out. Any particular patient that particular day needing anything. Make sure no one's hospitalized or everyone is okay. I go over a visit with them, take their vials, of course. Make sure, getting ahead to see how their day's going. I find that a lot of people need that support. Like, a lot of them have family, but they don't check in on them. So they do value you asking how their day going. You asking them little simple questions. What you eat today? Or, how you making out? Or, what you feel like doing? Things like that makes a difference to the patients here.
I've had one virtual visit with a homeless patient. He was just coming out of the hospital, callus or something on his foot that got infected. So it gave him access to a doctor. He and I are working on ways for him to get food to help with his diabetes. The homeless shelter that he goes to, the food that they serves him no nutritional value. So we're working on trying to get him, other food options.
Start off with, like, if I had to go out in the field with one of my patients, because most of my patients are early risers, very morning, or get a morning call or anything like that. And then it just go into, like, field visits to phone calls to making sure doctor's appointments are up to date, depending on what patient I'm talking to, making sure whichever patient I'm talking to has their medication, or do they need to talk to someone. Sometimes my patients may need mental health advice, which I have some knowledge of, but it's good to also know that it makes it so much better for my team that I know somebody on my team who has better knowledge than I do, and they also help me learn more about what my patient's mental health is.
A day in the life of the care specialist is like being on call at a hospital, I would say. You literally have patients calling you from the time that you clock in until you clock out, but it's always is like, I look at it as being a helping hand, like, to people who may lack the resources.